Hi, I am Dr. Stefan Yakubian. Welcome to my channel, Health with Seniors. If you're over 60, this one small habit might be silently raising your stroke risk while you sleep. No warning, no pain, just a sudden moment where everything changes. You've probably heard that certain habits can affect your health, but what if I told you there's one thing many seniors do every day without realizing the hidden dangers? It's something that's often seen as a good thing, vitamins. Now, I know what you're thinking. Vitamins are good for me, right? Well, not always. Every day, millions of older adults take supplements to protect their bones, boost their energy, or keep their memory sharp. And while many vitamins do help, there's a twist. Some, especially when taken in high doses or at the wrong time, can quietly increase your risk of a stroke, brain bleed, or blood pressure spike, especially while you sleep when your brain is most vulnerable. If you've ever taken vitamin D, E, B6, A, or niacin, you need to hear this. Today, I'll walk you through 5 common vitamins that could be putting your brain at risk. Before we get started, I'd love to know, have you ever questioned whether your vitamins could be doing harm? Type 1 in the comments if you're curious to learn more, and type 0 if this is all new to you. No one. Vitamin D, the hidden risk. Vitamin D is often celebrated for its benefits to bone health, mood, and the immune system. But here's the truth. Too much vitamin D, especially taken at night, can silently increase your risk of a stroke. I know that might sound shocking, but I've seen it with my own patients. Take Mr. Walter, for example. He was a 74-year-old retired Navy vet, sharp, disciplined, and always taking his health seriously. Every morning, like clockwork, he lined up his supplements, including a 10,000 IU vitamin D capsule he bought over the counter. He thought it was helping protect his bones. But what he didn't know was that this simple routine was slowly pushing him toward a silent disaster. One morning his wife found him confused, unable to speak clearly, with his right arm hanging limp. He'd suffered a stroke overnight. His lab results showed dangerously high calcium levels, stiff arteries, and blood pressure all over the place. The culprit? Vitamin D toxicity. Here's why this happens. When you take high doses of vitamin D, especially without medical guidance, it causes calcium to build up in your bloodstream. Your body doesn't know what to do with that extra calcium, so it sends it into your arteries, making them stiff and narrow. This can lead to blood clots, which can travel straight to your brain. As we get older, our arteries naturally lose flexibility. And with dehydration, poor sleep, and a calcium spike at night, you have the perfect storm for a stroke. The scariest part? There are no warning signs. You go to bed feeling fine and wake up with your life forever changed. And here's something most people don't realize. Many over-the-counter vitamin D supplements contain much more than older adults actually need. Some have 5,000 IU or even 10,000 IU, which can be far too much. Studies show that even 2,000 IU daily might be too much if you're not deficient. So if you're taking vitamin D, especially with calcium or heart medications, make sure to get your blood levels checked regularly and always take it in the morning, never before bed. Note 2. Vitamin E, the heart helper that can hurt your brain. Vitamin E is often considered a heart-healthy supplement, known for supporting circulation and even boosting memory and skin health. But did you know that in high doses, especially when combined with common heart medications, vitamin E can actually increase your risk of bleeding in the brain? Let me share a story that will stick with you. Mrs. Evelyn Brooks, 81, was a sharp and witty retired librarian from Ohio. She had a heart valve issue and was on warfarin, a common blood thinner. Her doctors carefully monitored her blood work and pressure, and everything seemed fine. But one day she picked up a bottle of natural vitamin E after seeing it advertised in a magazine, 800 IU per capsule. She thought it would help her circulation and memory. 3 weeks later, she was rushed to the ER with a terrible headache, confusion, and vomiting. A brain scan showed a hemorrhagic stroke, bleeding inside the brain, not due to high blood pressure or a fall, but because the combination of warfarin and high-dose vitamin E had made her blood too thin to clot. Just one fragile blood vessel in her brain gave way. Here's what most people don't realize. Vitamin E, when taken in high doses, acts as a natural anticoagulant. That means it slows the clotting process. If you're already on aspirin, Plavix, or any blood thinner, and you add vitamin E, your risk of internal bleeding goes up, especially in the brain, where even a small bleed can steal your ability to speak, remember, or walk. The recommended daily intake for older adults is just 15 milligrams, about 22 international units. But many supplements contain much higher doses, 200, 400, or even 1,000 international units per capsule. And people take them every day, often for years, with no warning. Mrs. Evelyn survived, but now she walks with a cane and her short-term memory was never quite the same. She told me through tears, "I just wanted to help myself. I didn't know I was doing harm." This is a common story, and it's heartbreaking because many seniors don't realize that if it's a vitamin, it doesn't always mean it's safe. No 3. Vitamin B6, the nerve support that can damage your nerves. Vitamin B6 is often touted as a nerve support supplement, promising to help with energy, focus, and memory. But what most people don't know is that too much vitamin B6 can actually damage your nerves, sometimes permanently. Let me tell you about Mr. Harold Jenkins. He was 76 years old, a retired truck driver from Kansas. He came into my office because his feet were numb, his hands were tingling, and his balance was off. At first he thought it was just the result of aging. Then he started falling, once, twice, and the third time he hit his head on the bathroom floor. When I reviewed his supplements, I found the issue immediately. He'd been taking a nerve support formula for over a year, and each tablet contained 100 milligrams of vitamin B6. He was taking 2 tablets a day, which meant he was consuming 200 milligrams daily, over 10 times the recommended upper limit for seniors. Unlike some vitamins that flush out of your system, vitamin B6 builds up in your body over time. In older adults, it can damage the protective coating around your nerves, similar to stripping insulation off a wire. The result? Tingling, numbness, muscle weakness, tremors, and even confusion or memory loss. The worst part is that the symptoms develop slowly, and many people mistake them for arthritis, aging, or even early dementia. But the truth is, it could be B6 toxicity, a preventable type of nerve damage caused by a pill meant to help. Fortunately, Mr. Jenkins was lucky. We stopped the supplement in time, and the damage didn't worsen. However, he still uses a cane and no longer drives. He told me, "I just wanted to protect my brain. I didn't realize I was poisoning it." Vitamin B6 is important for your health, but older adults only need about 2 to 10 milligrams per day, including what they get from food. Many brain support pills, however, contain 50, 100, or even 200 milligrams of B6, which is not just unnecessary, it's dangerous. So if you're taking any supplements that claim to support your nerves, brain, or energy, check the label and know your numbers. If you or someone you know is taking high-dose vitamin B6, it's time to rethink that routine. No 4. Vitamin A, the eye health vitamin that can impact your brain. Vitamin A is essential for good eyesight, and many people take it to help with skin health or to slow down the aging process. But here's something most seniors don't realize. Too much vitamin A can cause a buildup of pressure inside your skull, mimicking stroke symptoms and even damaging your vision and brain. Let me tell you about Ms. Dorothy Simmons. She was 79 years old, a retired piano teacher from Oregon who loved teaching music to her students. She took pride in staying independent, but one day she started getting headaches, followed by blurred vision, dizziness, and slurred speech. Her family feared the worst, maybe a stroke. But when we ran her scans, something surprising appeared. No clot, no bleeding, but instead elevated pressure inside her brain. The cause? Vitamin A toxicity. You see, vitamin A is fat-soluble, meaning it gets stored in your liver, tissues, and even your brain. Unlike water-soluble vitamins that your body flushes out when you take too much, vitamin A builds up over time. And as we get older, our liver slows down, causing that buildup to happen even faster. When there's too much vitamin A in the body, it can lead to a condition called pseudotumor cerebri, a false brain tumor. The symptoms include headaches, blurred or double vision, dizziness, nausea, and in some cases, permanent vision loss or cognitive decline. The tricky part is that many multivitamins already contain the recommended daily dose of vitamin A, but some people like Ms. Dorothy unknowingly double or triple that dose by adding skin, eye, or anti-aging formulas. The safe upper limit for seniors is around 2,500 to 3,000 IU per day, and that's only if it's needed under medical supervision. Yet many supplements on the market contain 5,000 to 10,000 IU or more, taken daily for months or even years. Ms. Dorothy is slowly recovering, but she now needs regular eye exams, pressure checks, and balance therapy. She told me, "I thought I was doing something good for my body. I never imagined it could hurt my brain." No 5. Niacin, the heart helper that can spike your blood pressure. Niacin, also known as vitamin B3, is often recommended for heart health and to help lower cholesterol. It's also found in many heart health supplements, energy drinks, and fortified cereals. But here's the hidden truth: in high doses, niacin can cause serious swings in your blood pressure and even trigger a stroke. Take Mr. Frank Miller, for example. He was 82 years old, a retired postman from Florida. One morning he came to see me with a strange mix of symptoms. Hot flashes on his face, a pounding sensation in his chest, dizziness that came and went. His wife thought it was just anxiety, and his son blamed it on his blood pressure meds. But the real cause, something no one had checked: his over-the-counter heart-healthy supplement. The label on the bottle said, "Supports cholesterol and circulation," but the back of the bottle revealed a shocking amount: 1,000 milligrams of niacin per serving. He was taking 2 doses a day, which meant 2,000 milligrams daily, over 60 times the amount most seniors actually need. Here's what happens when you take niacin in high doses. It causes your blood vessels to suddenly expand, which is why your face may feel warm or flushed. But soon after, those same blood vessels snap back and constrict, causing a sudden increase in blood pressure. This yo-yo effect stresses your heart, reduces blood flow to your brain, and increases your stroke risk. Over time, this cycle can damage fragile blood vessels in your brain, triggering a stroke. Frank had what's called a transient ischemic attack, TIA, or a mini-stroke. His speech slurred for about 2 minutes before returning to normal, and he thought it was a one-time fluke. Unfortunately, I had to tell him the hard truth. His daily niacin supplement, meant to help his heart, was quietly harming his brain. Here's what you need to know. For older adults, anything over 50 milligrams of niacin per day should only be used under medical supervision. If you have high blood pressure, heart rhythm issues, or are on medication, check your labels carefully. Frank is now off niacin and is recovering with no permanent damage. But he said, "I thought I was doing everything right. I didn't know I was gambling with my brain." The alternative: real food, real protection. By now, you might be wondering, if these vitamins can be risky, what should I do instead? It's a great question, and the truth is, your body wasn't designed to run on pills. It was built to thrive on real, whole foods that your brain recognizes, absorbs, and uses in just the right amounts. Let me tell you about Mrs. Margaret Wilson, a 73-year-old retired school principal from Arizona. When I first met her, she pulled out a drawer full of supplements. Vitamin D for bones, vitamin E for heart health, B complex for energy, niacin for cholesterol, and a multivitamin for overall brain support. She thought she was doing everything right, but she was feeling dizzy in the mornings, her balance was off, and her blood pressure kept climbing. Something didn't add up. So we did something radical. We cleared the clutter. We took away all the pills and replaced them with food. No magic diet, no fancy program, just simple, whole foods at the right time and in the right combinations. Here's what her breakfast looked like. 1 boiled egg for clean protein, half an avocado rich in healthy fats, a slice of whole grain toast for steady energy, a handful of blueberries loaded with brain protective antioxidants, and a glass of room temperature water to hydrate her brain. Sometimes she added a few walnuts or almonds. That was it. No powders, no pills, just food. Within just a few weeks, Margaret noticed a big difference. Her dizziness faded, her blood pressure stabilized, and her energy returned. She told me her mind felt clearer than it had in years. And here's why it worked. Your brain needs hydration, healthy fats, consistent fuel, and micronutrients in their natural form. It doesn't need megadoses of supplements, it needs balance. Some of the best foods for older adults include leafy greens like spinach and kale, which are rich in folate and antioxidants. Fatty fish like salmon and sardines, packed with omega-3s to protect brain cells. Berries for polyphenols that reduce inflammation. Nuts and seeds for vitamin E, magnesium, and healthy fats. And whole grains to keep blood sugar stable and support circulation. Remember, these foods don't just protect your brain, they support your heart, bones, mood, and mobility too. By making these small changes, you're not just eating, you're healing with every bite. Final wake-up call. Awareness is the best medicine. At this stage in life, every choice you make matters more than ever. And the truth is, it's not the pills you take, but what you understand about them that truly protects you. Your body at 60, 70, or 80 doesn't process supplements the same way it did decades ago. Even well-meaning habits like taking vitamins can quietly backfire if you're not careful. That's why awareness is your most powerful medicine. You don't need to fear vitamins, but you do need to respect them. Read the labels, ask your doctor, and listen to your body, especially when it whispers. If any part of this video spoke to you, I want to hear from you. What's one change you'll make starting tomorrow? Leave a comment below and let me know. If you found this information helpful, give this video a like to help others find it too. And don't forget to subscribe to our channel so we can continue learning, growing, and staying strong together. You're not alone on this journey, and you're never too old to take back control of your health.